Majority Whip.
I ask consent the quorum call be suspended.
Without objection.
Mr. President, we have some rare good news on the public health front. COVID cases are down to the lowest level since July. Crucially, hospitalizations and deaths are also down dramatically, more than 70% lower than they were in January during the Omicron wave. Compared to just a few months ago, our nation is experiencing far less suffering and death. Thank goodness. But despite the progress we've made, COVID continues to be a threat. Every day, 800 American families lose a loved one to COVID, 800 a day, and catch new infections which present an opportunity for the virus to mutate. We're at a turning point in this fight against COVID. Now we need to strengthen our healthcare system. We need to stay a step ahead of this deadly virus. That's especially true since the subvariant of Omicron, BA.2, as it's known, has become dominant in America. Remember the frenzy last holiday season when we were running from pharmacy to pharmacy trying to find rapid tests for our families, or waiting in the freezing cold for hours on end to get a PCR test? Why would we ever want to get caught flat-footed again? We need to sustain our public health so that our hospitals and healthcare professionals have the equipment and tools they need to keep us safe. The one thing dramatically worse than returning to the dark days of COVID-19 and the deadly variants would be to return unprepared. If we want to keep our masks off, and I do, want to keep our kids in school, and I do, and our businesses open, we need to make smart investments in America's capacity to confront future strains of these variants. We can't continue this cycle of neglect and panic. The pendulum swings harm our health system and contribute to unnecessary cost and suffering. Congress must come together on a bipartisan basis, and shouldn't we all agree on this, that we move as a nation in the same direction? That means providing funding to purchase new booster doses, including those which the FDA authorized this week for adults over the age of 50. I got mine yesterday morning. If we don't purchase these vaccines now, ahead of time, then we'll be sleepwalking into the next deadly wave. We also need to ensure that as soon as the FDA authorizes a vaccine for kids under the age of 5, parents can get their kids protected as soon as possible. Funding also is needed for oral antivirals and other therapeutics to treat patients who contract a serious case of COVID. These treatments will keep our hospitals from being overwhelmed. And we need funding to maintain the testing infrastructure we built up over the last several months, like President Biden's successful program to put up to 1 billion rapid tests right at the doors of every American that wants one. The fact is, Congress should have already provided funding for these life-saving resources, but we still haven't done it. This lack of funding has already hit my home state of Illinois. Last week, shipments of monoclonal antibody treatments to our state were scaled back 35% to preserve the supply. Also last week, thanks to a lack of funds, the Department of Health and Human Services announced it would no longer pay hospitals and health clinics for the testing they provided to 30 million uninsured Americans. Several free community-based testing sites and pharmacies in Illinois are now closing up. The money's running dry. At one community health center in Illinois, 1/3 of the patients are uninsured. That clinic has received more than $150,000 to test, treat, and vaccinate the patients. Money well spent, not just to protect these patients, but every Illinoisan. If Congress doesn't provide new funding, that health center may be forced to close for good. All of us want to keep the masks off for good and move past this coronavirus. But to think we can just wish away COVID forever would be naive, irresponsible, and fiscally unwise. I urge my Republican colleagues to join in a bipartisan effort to provide new funding for our COVID preparation and response efforts. Let's be ready for whatever this virus might bring. Mr. President, finally, I want to say at a separate part in the record with unanimous consent, I want to take a special moment to thank a member of my staff who is leaving on new assignment. History tells us there have been some extraordinary African-American women in the field of science. Dr. Alice Ball was a chemist who developed the first successful treatment for leprosy. Dr. Patricia Bath was an ophthalmologist who invented something called the laser photoprobe, a tool used in cataract surgery. Dr. Shirley Jackson was the theoretical physicist and former chair of the U.S. Nuclear Regulatory Commission. What did they all have in common? They were African American women who broke barriers and improved the lives of countless others. They didn't get the public recognition they deserved. Well, let me add another name to that list. Her name is Dr. Jasmine Hunt Demetrio. Dr. Hunt, known as Jasmine in our office, joined my staff in 2010 on an American Association for the Advancement of Science Fellowship. She was a newly minted PhD in chemistry who had just graduated from the University of California at Santa Barbara. The fellowship in my office lasted a year, but thank goodness she liked it, so she stayed. We persuaded her to stay longer and devote more than 10 years of her life to public service. Over the years, Jasmine climbed the office ranks from fellow to lead policy advisor for science, energy, and environment to legislative director. Today is her last day in the Senate. She's leaving to take on a new challenge as Deputy Chief of Staff to Energy Secretary Jennifer Granholm. I know I speak for my entire staff when I say that we're thrilled for her. This is a well-deserved recognition and opportunity. I hate to lose her, but I never want to stand in the path of my staff if they've got a chance to promote themselves and to use their talents more effectively. We're going to miss her. Jasmine grew up in Normal, Illinois, which is perfect. She's about as normal and stable a person as you'll ever find. No matter how long the hours are, how tumultuous the mood, she's always clear-headed and calm. Her mother loved libraries and passed that love along to Jasmine and her brother Joseph. Thankfully, Jasmine remains a voracious reader and learner. I don't know which is more complicated, understanding how to split an atom or how a bill becomes a law, but Jasmine has mastered both. During her years in the Senate, Jasmine and her husband Mike became parents to two of the cutest little girls. She also has been something of a mother figure to countless young members of my staff whose careers she nurtured. Now she'll bring her leadership for the nation to the Department of Energy. I have no doubt that in little time she'll manage to stop climate change with a Thanos snap. She is a remarkable scientist and public servant, and I want to thank her for devoting so much of her time and talent to help me, to help the state of Illinois, and to serve this nation. Jasmine, best of luck. Mr. President, I yield the floor.